To acknowledge International Day of the Midwife on the 5th of May, we've asked some staff to record their views of what's happened over the pandemic.
I think the impact of COVID in terms of some of the families that we work with that have vulnerabilities is that those vulnerabilities have increased. But we've got a really good team of specialist midwives that are still going out to support families in their homes. So that's been really positive.
Since COVID's arrived, the mums have a lot more time with their babies at home and the bonding is a lot better for them.
I feel over the past year we've been able to grow closer as a team as we've been able to support each other through all the changes, so that's been a good thing.
One of the things I found really beneficial with COVID is being training. It's just easier to join online and keep up with your training.
During the lockdown period, I was fortunate enough to go to 2 home births because we were still able to provide that service to the women in Fife, and it was lovely to be able to support them during their birth experience in the home setting.
Throughout COVID, it's actually been beneficial to the staff when we've had team meetings. A lot of times staff aren't able to attend meetings, but now that we've started up these Teams meetings, I do feel that a lot more staff are attending.
One of the positive things I've noticed is mums have more quality time to bond with their babies.
Hi, I miss children coming in to see their new babies.
Just some of the changes that we've made in the last year that we think have been advantage to the women and the staff. The main ones being the way we do the booking histories for the women. It's done on a much more individual basis when it suits the women and the midwife. We can be more flexible with the times and doing them on near me or the phones. I think the staff would agree it's worked in women's and staff's favour. And the same goes for a bit more flexible working times. A lot of the midwives now starting from home and not having to come into the office in the morning. They're all finding that works quite well. So hopefully there'll be changes that we'll keep in place as time goes on.
Okay, so the last year with COVID restrictions has meant we've had to change the way we deliver some aspects of our care. But as a team we've all pulled together and the women of Fife are getting just as good care as they did before. I'm very proud of the way that the women of Fife have embraced the wearing of masks and adhered to everything that we've actually asked them to do.
It's been great that we've managed to keep the outpatient department running smoothly throughout the pandemic.
So in the last year our clinics have changed. We've now been triaging patients daily basis prior to the day before they attend their clinics.
I'm a newly qualified maternity care assistant. I have only ever worked during the COVID pandemic, so this is the norm for me.